I think it's quite interesting when we look at the one of the most popular open source healthcare products in the US. So that's in a provider-payer marketplace, the last bastion of liberal capitalism, and all of their veterans' healthcare services are run from an entirely open source stack that was developed by some developers and clinicians when the Vista, when the veterans' care was getting worse and worse and worse. And one of the things that they were identifying was our systems are crap. So Vista is open source. Vista is massively implemented in the US. It does the healthcare for the entirety of Jordan, and we're trying to get other implementations of it. So here's an example of, in a sense, the wheel that they reinvented was one about a process and interactions, and changed that paradigm of doing stuff. And then there was some code that was given away. And I think if we can do that, those bits of education with the very senior people in the NHS, people like Charles Gottridge, the Chief Medical Officer, he's aware of Hack Day, he knows what we're doing. When asked recently, what do you think of it? He said, I want to know how we get these ideas through. Well, the answer, Charles, is you are the answer. I mean, Tim Kelsey from the commissioning board wants to do, he started talking about a patient portal. I was like, yeah, well, and good luck with that, because you've got a whole bunch of different vendors who have all got competing motivations in there, and that's probably not going to happen. Now he's talking about a patient platform. Now a platform could be a connected thing which would talk to these back ends and allow you to present that layer up, and allow the innovators in this room to start having opportunities to build things. So yeah, those very senior people, if they would put their backs behind some of these ideas, and they are beginning to do it. There is an open data platform Hack Week happening at the Health and Social Care Information Centre. There is, after this, there's a paid hack couple of days that Carl is running to do some stuff for the NHS Institute. So it's starting to happen. But I think what we need is at the very top to say, one of the ways that we'll deliver on the Nicholson challenge of saving 20 billion is by stopping buying crap, and at least build our own crap, and it might actually be better.
Yeah, brilliant.